So now we are starting our new series for DNB examinations preparation, which is mainly starting from the oncology part in obstetrics and gynecology. And first of all, we are going to learn about endometrial cancer. So endometrial cancer is the cancer of the uterus epithelium. So uterine cancers are divided into two parts. First one, uterus is having corpus and the cervix. So cervical cancer we will study separately, and the cancer of the uterine corpus includes the cancer of the epithelium and the mesenchyme. Epithelial cancer is known as endometrial cancer, while the cancer of the mesenchyme of the uterine corpus is known as sarcoma. Coming to epidemiology, six most common cancer worldwide for females, and the 14th most common cancer overall. The most common symptom of endometrial cancer is postmenopausal bleeding, and the probability of endometrial cancer in women with postmenopausal bleeding is 5 to 10%. The median age of onset is 63 years with a range of 55 to 70 years of age. 25% cases occur in premenopausal females, so we can offer fertility sparing surgeries in them if they are not yet having any baby. At diagnosis, 75% of the women disease is confined to uterus or stage 1 cancer, because this cancer most commonly occur in postmenopausal females, and the bleeding has already stopped for many years, and now suddenly patient is coming with complaint of uterine bleeding. So we have to rule out this cancer through endometrial biopsy, and through which the disease can be diagnosed at an early stage. 10 to 15% are diagnosed in extrauterine disease and leads to 50% of uterine cancer related deaths. Now, coming to the risk factors, there are certain risk factors which are associated with endometrial cancer, and this includes conditions which have more propensity of higher estrogen levels and leading to endometrial proliferation and thereby cancer. So the first risk factor is age. Mostly occurs in a women with age of more than 55 years. Menstrual factors include early menarche and late menopause, means a hyperestrogenic environment where unopposed estrogen exposure carries 1.5 to 4 times higher risk. Parity, high parity, and pregnancy and abortions are protective factor. OCPs also reduce the risk of ovarian cancers as well as the endometrial cancer, because there is an anovulatory stage, and there is risk reduction that starts from 3 years of use with 80% reduced risk after 10 years, and protection lasts for 20 years after stopping the OCP. Now for PCOS also increase the risk of endometrial cancer because it occurs due to chronic anovulation and hyperestrogenic environment. HRT, also exogenous estrogen therapy, increases the risk of endometrial cancer. Tamoxifen is agonistic on endometrium, so it promotes uterine endometrial proliferation. So if in a breast cancer patient, BRCA1 association and tamoxifen use simultaneously increase the risk of endometrial cancer. There are certain another hyperestrogenic conditions where there is estrogen secreting ovarian tumor known as granulosa cell tumor of the ovary, which also leads to endometrial cancer.